Hello there, I'm Dr. Lucy and this is Know Your Health with Dr. Lucy, a space where we share everything concerning your health and pregnancy. Today we're going to talk about something that many women experience but often ignore: danger signs during your periods. Yes, periods can be uncomfortable, but there are some symptoms that are not normal and may be a sign that your body needs medical attention. Let's get into it. The first danger sign is having irregular menstrual cycle. What do I mean by this? A normal menstrual cycle is when your cycle length falls between 21 to 35 days. That is counting from the very first day that you see your period to the day before you see your next period. So if your cycle falls between 21 to 35 days, then your cycle is normal. But if your period starts before 21 days or comes later after 35 days, then you have an irregular cycle, and that is not normal. A cycle shorter than 21 days may mean that you're not ovulating properly, or your hormones like estrogen and progesterone are out of balance. It can also be caused by stress and thyroid problems. So women with cycle length less than 21 days always get challenges of getting pregnant. This is because it's always hard to track their ovulation window. And then a cycle longer than 35 days often suggests conditions like PCOS, which is polycystic ovarian syndrome, a condition that is one of the most common causes of infertility in women. PCOS is caused by the imbalance in your female hormones, which will cause several small cysts to be on your ovaries, and excess production of the male hormone in your body. And also remember that some infections or long-term contraceptive use can also affect your cycle. In other words, irregular cycle length can make it hard to know your fertile window, affect your chances of getting pregnant, and point to deeper health problems. So if this happens for 3 cycles in a row, it is wise to see your doctor for proper evaluation. The second danger sign to look out for is your periods lasting for more than 7 days or less than 2 days. A normal menstrual period lasts for 2 to 7 days, so if your bleeding stops in just 1 day or continues past 7 days, then that's a danger sign that you should look out for. Periods more than 7 days is called long periods, and this is usually seen in early puberty. Those are the early months when you just start seeing your periods, or when you're on birth control pills. That could be the cause of your periods lasting more than 7 days. Or it can also be a perimenopausal sign, that is, you are about to reach menopause. Another cause for long periods is uterine fibroids, which is a very common cause. Fibroids can cause your periods to be very heavy and it will last for longer than 7 days. So if you notice that your periods are suddenly heavier than before, that's a red flag, because fibroids can get complicated with infertility and anemia. Anemia is simply low blood levels, and when you have anemia, you can suddenly feel dizzy when you're on your periods. You can have iron deficiency depending on the severity of the blood loss. You can also hear your heart pounding. And then if your periods last for less than 2 days, that is just in 1 day or even just a few hours, this is also a red flag, because it could mean that you're pregnant and you're having implantation bleeding, or you're having a miscarriage and you're mistaking it for period blood. And also for women on birth control pills, they can notice bleeding for less than 2 days. So if you notice any of these danger signs of bleeding longer than 7 days or less than 2 days, you need to see your doctor for proper evaluation. Another serious danger sign is extremely painful periods, the kind of pain that is so intense, it interferes with your daily activities, makes you miss school or work, and even does not improve after taking painkillers. The pain radiates to your inner thighs, your lower back, you're having nausea, you're even vomiting. This is a red flag. Normal period pain should be something mild and bearable, but severe unbearable pain may mean something more serious. And it's often due to gynecological conditions like endometriosis. Endometriosis is a major cause of infertility, with period pain being the most commonest symptom. And apart from severe menstrual pains, women with endometriosis experience heavy menstrual bleeding, painful bowel movements, bleeding in between periods, and pain during sexual intercourse. So, if you experience extremely painful periods, you need to see your doctor. Another important danger sign to watch out for is having foul smelling periods. It's normal for menstrual blood to have a mild smell because of blood and tissue. But if your period has a strong, unpleasant, fishy, or unusually bad odor, This is not normal. A foul smell during your period can indicate infections like bacterial vaginosis, which causes a strong fishy smell, and also sexually transmitted infections like trichomoniasis, which causes a very bad smell. So when you notice that your period blood is unusually having a bad smell, see your doctor for proper evaluation. And another danger sign is bleeding in between your periods. Bleeding in between periods simply means you're done with your periods. For example, you're done with your 5 days of bleeding, or 6 days of bleeding, or even 3 days of bleeding. And before your next period, which is supposed to be on a certain day or even next month, you suddenly start to bleed again. And even when the day that you're supposed to go in your period reaches, you still bleed again. In simple terms, these are the people who say, I had my periods twice in a month or 3 times in 1 month. This is called bleeding in between your periods, and it is a red flag. It could be due to birth control pills, infections of your cervix, infections of the lining of your womb, sexual transmitted diseases like chlamydia, fibroids, thyroid diseases, and perimenopause as well. So if you experience this kind of danger sign, then you need to seek help from your doctor. And then lastly, missed periods. Missed periods is also a danger sign of periods that you should look out for. If you're supposed to see your period on a certain day and you miss your period, you don't see it that day or the next day or even the next week, that's a missed period. It could be pregnancy, but it's not only pregnancy that causes you to miss your period. But first of all, do a pregnancy test to rule out pregnancy. And if you've confirmed that it's not pregnancy, then there are other reasons for a missed period. 1. Stress, very low body weight, very high body weight, PCOS, birth control pills, primal ovarian insufficiency, which is when your ovaries are no longer working to release an egg every month like it used to be, yet you're less than 40 years. Because it's women who are clocking menopause who are supposed to have ovarian insufficiency. So if you're less than 40 years and you're having missed period oftenly, that's a red flag. To avoid all these danger signs, make sure that you see your doctor early enough to prevent any complications in the future. If you found this video helpful and you want more information like this, subscribe to my channel, like this video, drop any question in the comment section below, and I'll be glad to answer your questions. Thanks for watching. Let's meet again in the next video. Bye.